Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
When planning a visit to the parents of an infant who died of sudden infant death syndrome at home, the nurse should visit the parents at which of the following times? 1. A few days after the funeral. 2. 2 weeks after the funeral. 3. As soon as the parents are ready to talk. 4. As soon after the infant's death as possible. The correct answer is 4. The community health nurse should visit as soon after the death as possible because the parents may need help to deal with the sudden, unexpected death of their infant. Parents often have a great deal of guilt in these situations and need to express their feelings to someone who can provide counseling. When developing the ongoing plan of care for the parents whose infant died of sudden infant death syndrome, the nurse should plan to accomplish which of the following on the second home visit? 1. Allow the parents to express their feelings. 2. Have the parents gain an understanding of the disease. 3. Assess the impact of the infant's death on their other children. 4. Deal with issues such as having other children. The correct answer is 1. The goal of the second home visit is to help the parents express their feelings more openly. Many parents are reluctant to express their grief and need help. The goal of the first visit is to help the parents understand the disease and what happened. The first visit also provides time to help the parents understand that they are not to blame. Although it is important to assess the impact of SIDS on siblings, this is not the primary goal for the second visit. However, the nurse must be flexible in case problems involving this area arise. Typically, parents are unable to deal with decisions, such as having other children during the second visit, because they are grieving for the child that they lost. This topic may be discussed later in the course of care. A child has just ingested about 10 adult-strength acetaminophen pills. The mother brings a child to the emergency department. What should the nurse do? Place the interventions in the order of priority from first to last. 1. Administer activated charcoal. 2. Assess the airway. 3. Reassure the mother. 4. Check serum acetaminophen levels. 5. Obtain a history of the incident. 6. Complete a physical examination. The correct order is 2, 1, 3, 6, 5, and 4. Immediate care of the child who has ingested acetaminophen is to ensure airway, breathing, and circulation. Next, the nurse should administer activated charcoal. Acetylcysteine mucimist may also be used as an antidote. When the child is stable, the nurse should reassure the mother. Next, the nurse should perform a physical exam to assess the child for other health problems, and then obtain further information about how the child obtained aspirin. The serum acetaminophen level should be obtained 4 hours after ingestion. On finding a child who is not breathing, the nurse has someone activate the emergency medical system and then does which of the following first? 1. Clear the airway. 2. Begin mouth-to-mouth resuscitation. 3. Initiate oxygen therapy. 4. Start chest compressions. The correct answer is 4. When breathlessness is determined, the priority nursing action is checking a pulse and beginning compressions. After 30 compressions, the nurse opens the airway and gives 2 breaths. Oxygen therapy will not be initiated at this time because the child is not breathing. Also, administering oxygen therapy would interfere with providing mouth-to-mouth resuscitation. Which of the following breathing rates should the nurse use when performing rescue breathing during cardiopulmonary resuscitation for a 5-year-old? 1. 10 breaths per minute. 2. 12 breaths per minute. 3. 15 breaths per minute. 4. 20 breaths per minute. The correct answer is 1. Rescue breaths should be delivered slowly at a volume that makes the chest rise and fall. For a 5-year-old child, the rate is 10 breaths per minute. If the nurse is also administering chest compressions, the rate is 2 breaths for every 15 compressions.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse begins CPR on a 5-year-old unresponsive client. When the emergency response team arrives, the child continues to have no respiratory effort, but has a heart rate of 50 with cyanotic legs. The team should next: 1. Discontinue compressions but continue administering breaths with a bag mask device. 2. Establish an intravenous line with a large bore needle while preparing the defibrillator. 3. Begin 2-person CPR at a ratio of 2 breaths to 15 compressions. 4. Begin 2-person CPR at a ratio of 2 breaths to 30 compressions. The correct answer is 3. CPR is done on children for a heart rate of less than 60 with signs of poor perfusion. Rescuers should use a 15 to 2 compression to ventilation ratio for 2 rescuer CPR for a child. Breaths without compressions are indicated only for respiratory arrest where the heart rate remains above 60. The AED/defibrillator should be used as soon as it is ready, but rescuers should not discontinue compressions until the device is ready for use. The ratio for 2-person CPR in adults is 30 to 2. As part of a health education program, the nurse teaches a group of parents CPR. The nurse determines that the teaching had been effective when a parent states: 1. If I am by myself, I should call for help before starting CPR. 2. I should compress the chest using 2 to 3 fingers. 3. I should deliver chest compression at a rate of 100 per minute. 4. If I can't get the breaths to make the chest rise, I should administer abdominal thrusts. The correct answer is 3. To maintain the best perfusion, it is recommended that compressions be given at a rate of 100 per minute in a ratio of 30 compressions to 2 breaths for 1 rescuer CPR. Children still are more likely to have had a respiratory arrest than a cardiac arrest and are more likely to respond to opening the airway and rescue breaths. Therefore, it is recommended that unless the collapse was witnessed, a sole rescuer should attempt 5 cycles of CPR before leaving a call for help. Using 2 to 3 fingers for chest compressions is recommended for infant CPR only. Abdominal thrusts are no longer recommended for unconscious victims. When performing cardiopulmonary resuscitation CPR, which of the following indicates that external chest compressions are effective? 1. Mottling of the skin. 2. Pupillary dilation. 3. Palpable pulse. 4. Cool, dry skin. The correct answer is 3. With CPR, effectiveness of external chest compressions is indicated by palpable peripheral pulses, the disappearance of mottling and cyanosis, the return of pupils to normal size, and warm, dry skin. To determine whether the victim of cardiopulmonary arrest has resumed spontaneous breathing and circulation, chest compressions must be stopped for 5 seconds at the end of the first minute and every few minutes thereafter. A nurse walks into the room just as a 10-month-old infant places an object in his mouth and starts to choke. After opening the infant's mouth, which of the following should the nurse do next to clear the airway? 1. Use blind finger sweeps. 2. Deliver back slaps and chest thrusts. 3. Apply for subdiaphragmatic abdominal thrusts. 4. Attempt to visualize the object. The correct answer is 2. The nurse should use mechanical force, back slaps and chest thrusts, in an attempt to dislodge the object. Blind finger sweeps are not appropriate in infants and children because the foreign body may be pushed back into the airway. Subdiaphragmatic abdominal thrusts are not used for infants age 1 year or younger because of the risk of injury to abdominal organs. If the object is not visible when opening the mouth, time is wasted in looking for it. Action is required to dislodge the object as quickly as possible. When preparing to deliver back slaps to an infant who is choking on a foreign body, in which of the following positions should the nurse position the infant? 1. Head down and lower than the trunk. 2. Head up and raise above the trunk. 3. Head to one side and even with the trunk lower than the head. 4. Head parallel to the nurse and supported at the buttocks. The correct answer is 1. To deliver back slaps, the nurse should place the infant face down, straddled over the nurse's arm, with the head lower than the trunk and the head supported. This position, together with the back slaps, facilitates dislodgement and removal of a foreign object and minimizes aspiration, if vomiting occurs. Placing the infant with the head up and raised above the trunk would not aid in dislodging and removing the foreign object. In addition, this position places the infant at risk for aspiration should vomiting occur. Placing the head to one side may minimize the risk of aspiration. However, it would not help with removal of an object that is dislodged by the back slaps. Placing the infant with the head parallel to the nurse and supported at the buttocks is more appropriate for burping the infant. A 6-month-old infant has had a cardiac arrest, and the rapid response team has been paged. The charge nurse arrives in the client's room and observes a licensed practical nurse administering CPR to an infant. See the figure below. To assist the LPN with CPR, the charge nurse should 1. Take over rescue breaths with a rate of 1 breath per 5 compressions using a bag mask device while the LPN continues compressions. 2. Take over compressions using one hand while the LPN uses a mask device to administer rescue breaths. 3. Take over rescue breaths using a rate of 2 breaths per 15 compressions using a bag mask device while the LPN delivers compressions. 4. Take over compressions at 80 compressions a minute while the LPN uses a bag mask device to administer rescue breaths. The correct answer is 2. The charge nurse should first obtain a bag mask device and assist with CPR by giving breaths at 2 breaths per 15 compressions. The LPN is using correct technique by using 2 to 3 fingers on the chest to administer chest compressions. The encircling hand technique may also be used during 2-person infant CPR. The heel of both hands is used for older children and adolescents. The compression rate is at least 100 per minute. When teaching the parents of an infant how to perform back slaps to dislodge a foreign body, which of the following should the nurse tell the parents to use to deliver the blows? 1. Palm of the hand. 2. Heel of the hand. 3. Fingertips. 4. Entire hand. The correct answer is 2. Back slaps are delivered rapidly and forcefully with the heel of the hand between the infant's shoulder blades. Slowly delivered back slaps are less likely to dislodge the object. Using the heel of the hand allows more force to be applied than when using the palm or the whole hand, increasing the likelihood of loosening the object. The fingertips would be used to deliver chest compressions to an infant younger than 1 year of age. While the nurse is delivering abdominal thrust to a 6-year-old who is choking on a foreign body, the child begins to cry. Which of the following should the nurse do next? 1. Tap or gently shake the shoulders. 2. Deliver back slaps. 3. Perform a blind finger sweep of the mouth. 4. Observe the child closely. The correct answer is 4. Crying indicates that the airway obstruction has been relieved. No additional thrusts are needed. However, the child needs to be observed closely for complications, including respiratory distress. Tapping or shaking the shoulders is used initially to determine unresponsiveness in someone who appears unconscious. Delivering chest or back slaps could jeopardize the child's now patent airway. Because the obstruction has been relieved, there is no need to sweep the child's mouth. Additionally, blind finger sweeps are contraindicated because the object may be pushed further back, possibly causing complete airway obstruction. A 3-year-old is brought into the emergency department in her mother's arms. The child's mouth is open and she is drooling and lethargic. Her mother states that she became ill suddenly within the past 2 hours. What should the nurse do first? 1. Draw blood cultures for a complete blood count. 2. Start an intravenous line. 3. Inspect the child's throat with a tongue blade. 4. Maintain the child in an undisturbed upright position. The correct answer is 4. This child is in severe respiratory distress with potential for complete airway obstruction. The nurse should refrain from disturbing the child at this time to avoid irritating the epiglottis and causing it to completely obstruct the child's airway. The child may be intubated or undergo a tracheotomy. However, initially, the child should be kept as calm as possible with as little disruption as possible. Any attempt to restrain the child, draw blood, insert an IV, or examine her throat could result in total airway obstruction. The father of a 16-month-old child calls the clinic because the child has a low-grade fever, cold symptoms, and a hoarse cough. Which of the following should the nurse suggest that the father do? 1. Offer extra fluids frequently. 2. Bring the child to the clinic immediately. 3. Count the child's respiratory rate. 4. Use a hot air vaporizer. The correct answer is 1. The toddler is exhibiting cold symptoms. A hoarse cough may be part of the upper respiratory tract infection. The best suggestion is to have the father offer the child additional fluids at frequent intervals to help keep secretions loose and membranes moist. There is no evidence presented to suggest that the child needs to be brought to the clinic immediately. Although having the father count the child's respiratory rate may provide some additional information, it may lead the father to suspect that something is seriously wrong, possibly leading to undue anxiety. A hot air vaporizer is not recommended. However, a cool mist vaporizer would cause vasoconstriction of the respiratory passages, making it easier for the child to breathe and loosening secretions.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A 21-month-old child admitted with a diagnosis of croup now has a respiratory rate of 48 breaths per minute, a heart rate of 120 beats per minute, and a temperature of 100.8 degrees Fahrenheit rectally. The nurse is having difficulty calming the child. Which of the following should the nurse do next? 1. Administer acetaminophen. 2. Notify the primary care provider immediately. 3. Allow the toddler to continue to cry. 4. Offer clear fluids every few minutes. The correct answer is 2. The nurse may be having difficulty calming the child because the child is experiencing increasing respiratory distress. The normal respiratory rate for a 21-month-old is 25 to 30 breaths per minute. The child's respiratory rate is 48 breaths per minute. Therefore, the primary care provider needs to be notified immediately. Typically, acetaminophen is not given to a child unless the temperature is 101 degrees Fahrenheit or higher. Letting the toddler cry is inappropriate with croup because crying increases respiratory distress. Offering fluids every few minutes to a toddler experiencing increasing respiratory distress would do little, if anything, to calm the child. Also, the child would have difficulty coordinating breathing and swallowing, possibly increasing the risk of aspiration. A child has viral pharyngitis. The nurse should advise the parents to do which of the following? Select all that apply. 1. Use a cool mist vaporizer. 2. Offer a soft to liquid diet. 3. Administer amoxicillin. 4. Administer acetaminophen. 5. Place the child on secretion precautions. The correct answers are 1, 2, and 4. Viral pharyngitis is treated with symptomatic supportive therapy. Treatment includes use of a cool mist vaporizer, feeding a soft or liquid diet, and administration of acetaminophen for comfort. Viral infections do not respond to antibiotic administration. The child does not need to be on secretion precautions because viral pharyngitis is not contagious. A father brings his 3-month-old infant to the clinic, reporting that the infant has a cold, is having trouble breathing, and just doesn't seem to be acting right. Which of the following actions should the nurse do first? 1. Check the infant's heart rate. 2. Weigh the infant. 3. Assess the infant's oxygen saturation. 4. Obtain more information from the father. The correct answer is 3. In an infant with these symptoms, the first action by the nurse would be to obtain an oxygen saturation reading to determine how well the infant is oxygenating, which is valuable information for an infant having trouble breathing. Because the father probably could provide no other information, checking the heart rate would be the second action done by the nurse. Then the nurse would obtain the infant's weight. While the nurse is working in a homeless shelter, assessment of a 6-month-old infant reveals a respiratory rate of 52 breaths per minute, retractions, and wheezing. The mother states that her infant was doing fine until yesterday. Which of the following actions would be most appropriate? 1. Administer a nebulizer treatment. 2. Send the infant for a chest radiograph. 3. Refer the infant to the emergency department. 4. Provide teaching about cold care to the mother. The correct answer is 3. Based on the assessment findings of increased respiratory rate, retractions, and wheezing, this infant needs further evaluation, which could be obtained in an emergency department. Without a definitive diagnosis, administering a nebulizer treatment would be outside the nurse's scope of practice unless there was a prescription for such a treatment. Sending the infant for a radiograph may not be in the nurse's scope of practice. The findings need to be reported to a primary care provider who can then determine whether or not a chest radiograph is warranted. The infant is exhibiting signs and symptoms of respiratory distress and is too ill to send out with just instructions on cold care for the mother. An infant is being treated at home for bronchiolitis. Which of the following should the nurse teach the parent about home care? Select all that apply. 1. Offering small amounts of fluids frequently. 2. Allowing the infant to sleep prone. 3. Calling the clinic if the infant vomits. 4. Writing down how much the infant drinks. 5. Performing chest physiotherapy every 4 hours. 6. Watching for difficulty breathing. The correct answers are 1 and 6. An infant with bronchiolitis will have increased respirations and will tire more quickly, so it is best and easiest for the infant to take fluids more often in smaller amounts. The parents also would be instructed to watch for signs of increased difficulty breathing, which signal possible complications. Healthy infants, and even those with bronchiolitis, should sleep in the supine position. Calling the clinic for an episode of vomiting would not be necessary. However, the parents would be instructed to call if the infant cannot keep down any fluids for a period of more than 4 hours. Parents would not need to record how much the infant drinks. Chest physiotherapy is not indicated because it does not help and further irritates the infant.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.